So our keynote speaker is Mr. Ajay Singh. He's a strategic advisor and VP of Strategic Growth at ISC New York. Ajay is a healthcare leader focusing on commercial and client strategy with significant expertise in innovative health tech products. His speech is titled Disrupting the Healthcare Industry with AI: How Can Technology, AI, and ML Tackle Costs, Engagement, and Outcomes?
Appreciate it. Welcome, everybody. Thank you all for letting me speak here. This is an honor and opportunity to be able to connect with so many people across the world in different industries that are focused on healthcare and the impact that AI ML can have. Today, what I really wanted to do was walk you all through really an understanding of where is the opportunity in healthcare for AI ML, specifically when we talk about healthcare in relation to providers and payers in the U.S. market. There's a lot of conversation for any of you that are either on the sidelines or trying to get involved or already, in the market. The idea of disrupting healthcare, why are there challenges? But what I really am hoping to kind of portray for you all today is the kind of key 5 areas where I believe and the industry believes AI ML can be valuable for the healthcare industry. So I'm going to go over, not only those 5 areas, but I want to be able to give everybody kind of an understanding of what is the challenge, what are the challenges that are facing healthcare today, and why is it really well suited for AI ML to have an opportunity to come in. So whether you live here in the US, whether you live across the world, it's pretty obvious that you can always look up and understand that healthcare is a challenge for the US market. There's conversations of how does a country that has the highest spend in healthcare still amongst well-developed countries, or first, to be able to still have poor outcomes compared to other leading nations. And so what I want to do to kind of just set the tone before I get into where is it that where AI ML can come in and help with healthcare, I really just want to paint the picture of, well, what is the landscape right now in healthcare in the United States? And there's really 3 key things that we're seeing today. And these are things that were always present even prior to the pandemic. And then there are things that have accelerated because of the pandemic. But what I think is important to go through in the landscape is to be able to share and understand something that I have had the ability and the enjoyment to do, which is sit in the seat of helping entrepreneurs, data scientists, researchers, analysts who are passionate about data, who are passionate about AI ML, come to market. I've been able to sit in the seats where executives, CEOs of hospitals, payers are actually evaluating the need and the urgency to bring on AI ML. And what I want this conversation to be with everybody here is not just the 5 areas and what are the drivers, but paint an understanding and a picture to all of you innovative folks of where and how you should really be thinking and positioning and entering into the market of AI ML for healthcare. So just to give, again, a background on the landscape, there's really 3 drivers that probably come to mind when it comes to describing the healthcare U.S. landscape. The first one is this idea of changing our clinical model, our payment model, the way we deliver healthcare, which is moving from fee-for-service towards outcome-based care. So currently right now, especially in the United States of America, we are what we call fee-for-service, which is our physicians, our nurses, our clinical model, our payers. Our healthcare delivery is delivered in a services model. We will continue to do procedures, prescribe tests, prescribe services without an understanding of the impact it has on the patient outcomes. We are paid and pay for providing services versus shifting towards an area where payments are awarded to anybody in healthcare based on the outcome of a patient. This could be how healthy they are, whether they develop diabetes, whether it's fixing or curing their cancer, or whether it's around reducing costs on how we spend on patients. So if the U.S. healthcare market were to actually shift from going from fee for service towards this payment that's structured based on our patient outcomes, what we actually see is that there is $1 trillion cost saving opportunity over the next 10 years. The second part is that in the healthcare market, especially in the US, compared to other industries in the US, there is a lack of consumer, or in our case, patient engagement. How knowledgeable are patients about the type of care they're going to receive, the type of services they can get, where they can find a provider, and ultimately an idea of how much do things actually cost? If we begin to look at other industries, there is a lot more cost, price, services, transparency that doesn't really exist in the healthcare market. And what we're seeing is that a lot of patients in the US are because of this lack of knowledge, it is increasing the amount of payments that they have that are not covered by insurance, or what we call in the industry out-of-pocket expenses. And the fact is, this out-of-pocket expenses, or payments that are not covered by insurance, will rise to about $490 billion total in the US by 2026. The other thing that definitely has been shifted by the pandemic is the ability to move or accelerate towards digital services, digital health, whether that's engagement, whether that's actually digital services provided in a house, or different ways that patients, payers, and providers can use a digital experience to improve outcomes. And what we will see is that there is a $7 billion annual savings in the US healthcare market if we have more adoption of digital health solutions. So these three drivers are very key to understand, because this is allowing all of you to learn what are the key challenges that are impacting and driving this need to disrupt healthcare. Now, one of the things that, as I said, I've had the opportunity to be a part of is I've started off my career working at the hospital side. And then after a few years, I worked in healthcare consulting. And I had the opportunity for 8 years to sit in the room where CEOs are making decisions for their health systems or for their insurance plan. The last few years, I have worked with 3 different healthcare startups that are all in the AI ML space. And the biggest challenge that I have seen for these companies to be successful is smart people understanding how to portray the message of the importance of AI ML to your buyers, which are these C-suite leaders that are in these healthcare markets. So even though I just shared what the landscape is for the entire industry, what I think is also important for everybody here on this call is to understand the people who are going to partner with you, whether it's your startup, whether it's your model, whether it is your interest, whether it is the research and analytics that you're doing, in order to convince the powers to be. We all need to understand what are the issues, or what I say, what are the up at night challenges that are facing healthcare executives in the market today here in the US. And that could be providers, payers, and life science companies. This data, that these 5 pieces that you're seeing here, are not just from my experience. There are companies, one of them that I used to work for, where they interviewed 2,000 healthcare executives across the country and surveyed them for their top challenges. So this is data driven, and I like it to be data driven because everybody we're here that is on this call are tied to or interested in passion AI ML, which is obviously all data driven. So the first challenge that people are facing, at least healthcare executives, when you ask them what is their biggest up at night issue, they talk about the workforce. That means that they feel that their current staff, nurses, doctors, administrative people, other clinical leaders are overworked and understaffed. The second issue is this concept that is not just about the clinical or the biological or the genetic makeup of a patient that dictates their health outcomes, but what we're starting to see is the environment. So what we call this is health equity and social determinants of health. This is where we begin to say, based on where a person lives in the United States, based on how much they make, based on how their living environment is, do we see changes in healthcare outcomes based off of that? The third challenge, which goes back to what we were talking about as industry change, which is now also aligned to the executives, is technology adoption. Pandemic has moved our patients away from the hospital to either be at home or other cares of site. So executives want to know, how do I engage with those patients? Because we can't get to a point where we stop engaging with them or only engage with them when they come to the hospital. As we talked about, this transition from fee-for-service to value-based care is a huge part. I think the biggest thing that comes up now is because there's so much opportunity for disruption in healthcare, this leads to other non-healthcare players coming into the market. So for those who are in the US or around the world, to give you an understanding, Oracle, company that we all know, has bought the second largest EHR vendor in the United States of America. Amazon obviously has pharmacy opportunities that they're moving into, and Walmart, where you get your groceries, your services, clothes, things like that, now have already started providing primary care. They have doctors in offices that are providing actual care, and Walmart's actual ambition is to be the largest provider of healthcare in the United States of America. So these are the top 5 challenges that are actually keeping executives up, what they're trying to solve every day when they step into their hospital or their company, or whether it's a payer or life science. So now that I've explained the landscape of what the industry is facing and then what the leaders are facing, what I want to say is what you're now seeing is a perfect landscape and ecosystem for AI ML to come in and make a difference, whether that's improving outcomes, reducing costs, or improving engagement. And what you see here are the 5 areas where AI ML is perfect for healthcare. And I give you these 5 areas because it's not just where the demand and the interest is right now. It's also where you all as leaders in the tech space can begin to focus your intelligence, your efforts towards really driving an impact. And what I'm going to do is I'm going to go through each one, but I really want to highlight the reason why AI ML is important for said category and what is the return on investment. There'll be a few use cases that you'll explain. I'll go at a high level because I understand some of our other speakers are actually going into some detail. So the first one is data and analytics. What is the reason why AI ML is needed for data and analytics? It's a very simple fact. The fact is that in healthcare, we have a vast range of massive data sets. And that looking through that type of size of data is the only way we are going to be able to uncover the true findings, whether that's root causes, interventions, or strategies. So because we're talking about large data sets and a range of data sets, it is really impossible for individual humans without AI ML to navigate through this type of data. So the impact AI and ML will have on data analytics is the ability to reduce the time and effort and resources that are currently being allocated to manually look through this data. So one of the big areas that I kind of look at this is in the United States of America, we have a lot of regulatory metrics that have been deemed by our government. We have many individual payers and commercial payers, but we have one of the largest, which is what we call Medicare. And in Medicare, they have a lot of regulatory metrics for physicians, for nurses, for hospitals, for long-term facilities. But to understand really the driver behind performing well or poorly in these regulatory metrics requires hospitals to look at massive amounts of data very quickly. And AI ML is going to be able to get to that data faster as well as with more accuracy. So it's actually going to help health systems truly understand the why behind their performance in regulatory metrics. The second area really talks about that up at night issue I said, which was number 1 for healthcare executives, which is the burnout. We are seeing a massive record of nurses leaving the industry entirely in the United States of America. It's never really been seen before. And a lot of this is because they have been entrenched in doing manual administrative workflows and have not been able to spend the time to do what they want to do, treat patients. So the reason why AI ML is there, it is going to allow these workforces to stop being overworked and who are under-resourced. And what you guys will be able to do with AI ML is reduce the hours spent on administrative tasks, reduce human errors, And really, at the end of the day, I talk about this thing of practicing at top of license. Physicians spend 12, 15 years becoming doctors. Nurses spend time and get multiple certifications and specializations to be good at what they're good at, treating patients. They didn't get into this industry to do paperwork. This is where you guys can come in and really help in that part of it. Whether it's using AI/ML for chatbots and voice bots to reduce call center volume, or specific in healthcare, we have a very outdated revenue cycle process. Based off the different diagnoses that a patient has when they come to a hospital, they will get certain billing codes that is tied to the reimbursement from a payer, from an insurance company. All of that is done manually. People reading doctor's notes, looking up which codes they need, and then sending those bills. What you can do with AI/ML and natural language processing, being able to pull those codes and automatically send those bills out. That can all be streamlined, saving costs and allowing providers to get back to what they do, which is taking care of patients. The third part is patient engagement. What we talked about is one of the two driving forces for the industry right now is the lack of consumer or patient transparency into healthcare, as well as the need to manage these patients now in a post-pandemic world, which is at home. Patients want smarter, patient-centric solutions for their needs and requests. Very simply put, patients want care when they need it and where they need it. And that is a huge lift for health systems to build and understand those nuances quickly. So you all can come in with AI/ML and provide these patient solutions that can help with engagement. So the last company that I was at, we were a conversational AI company. So we could actually build empathetic, automated communication. Very simply put, before a patient comes for a procedure, what if we were able to give them an outbound messaging that was scaled 15, 7, 3, 1 day before? And based off their responses, we were able to give them the right resources that they need. A person doing that takes time, effort, and it's not really the best solution that even patients want. AI can come in there and do that. The fourth area is what I would say is probably not emerging, but is now really top of mind for people, is precision medicine. This goes back to what I always say is if you're in the United States and you're watching a commercial for a pharmaceutical drug, they will tell you what type of patient it is fit for, and then give you a laundry list of all the things that you should look out for or allergic reactions you could have. To me, that is a generic medicine meeting a generic population. But how do we begin to personalize treatments and get the medications that are needed for specific populations within that? We're not just diabetic patients are not just diabetic. They can be diabetic with heart failure. They can be diabetic with neurological issues. They can be diabetic with COPD. All of those nuances begin to complicate the type of medications that we need. So where AI/ML can come in for precision medicine, meaning getting the right treatments to a tailored audience by specific genetic and phenotype information, that's where AI/ML can come in, because you're going to be looking at data sets that have never traditionally been integrated. And the amount of error, effort, and cost that exists to scale the pricing of drug discovery, clinical trials, and genomic medicine is a massive undertaking by people as itself. So AI/ML can come in and bring in data from biology, chemistry, genetics, phenotypes, clinical outcomes, claims data. These are all 5 different data sources that don't talk to each other today in healthcare. There are organizations that want to do this, but they are having 2, 3, 5, 10, 20 people trying to manually look at these data sets. AI/ML can do this quickly with efficiency. And the last area here is around diagnostics and prevention. One of the biggest things that I've always seen in healthcare, we talk about this, and I used to talk about this in my consulting days. In the United States of America, 10% of the entire patient population makes up 90% of the costs. This comes down to a simple fact that the sickest patients actually cost the most. So for us, when we talk about a chronic condition, diabetes, COPD, CHF, these are patients that are going to cost the industry a lot more money because they are sick, they need the services. But the idea is, what if we were able to identify these patients earlier, identify their risk earlier, and begin to impact their care before it gets too bad? Very simply put, the longer it takes to identify a patient at risk, the worse their outcomes and the cost is going to be. So AI/ML, taking in, again, different types of data, is going to be able to help with earlier diagnosis. The earlier you diagnose, the better the outcomes and the ability to reduce costs. So one of the areas here that I will talk about is sepsis. Sepsis is infection of the blood. Sepsis is a huge driver of mortality in hospitals in the United States of America. It's also something that we spend a lot of money on. Patients who come into the hospital who have acquired sepsis, they need to be treated fast. They need to get blood cultures, they need tests, they need fluids, they need antibiotics, all in very early hours, where they could be within the first 6-7 hours when they hit the ED. But in order to get to that with an overworked staff, AI/ML can begin to start looking at the different parameters, clinical differences, nuances of certain patients to be able to understand and trigger whether there needs to be earlier and the right timely treatment for managing sepsis patients. Lastly, around here, there's a lot of the ability to start helping medical imaging, begin to bring in other data points to what we have in medical imaging today, enhancing our medical imaging capabilities so that we can identify patients who could become diabetic, who could have COPD, who could have some certain types of cancers. If we can get ahead of that, we can intervene earlier, which is thus going to help their outcomes and our costs. So I want to just quickly conclude here with the fact that this industry is driven by people who are passionate about helping and saving patients. On the second side, there is a group of people who are very, very committed on improving the amount of cost that we spend on managing patients who really could have been treated better. We have a crack in the system when it comes to how our payments are done. And we have a crack in the system that patients are not understanding what's happening in the industry. When you have that much of a fragmented system, the biggest thing that can bring that together is technology. The providers, the clinicians who have spent the time to really treat patients may not understand where AI/ML can help them. But it's really on us, the scientists, the entrepreneurs, to begin to show them and work closely with them on how AI/ML can actually help them improve their day, make their life easier, help them, align them, and be a partner versus being viewed as a competitor. And I framed these 5 areas because these today are 5 areas where AI/ML can start right away and will not be viewed as an enemy or a threat, but is seen as an ally to help our healthcare network do what it does best, allow them to focus on their patients.